A hearty good afternoon to everyone, and welcome to a session on growth and development in children. It's a pleasure to have Dr. AVASH PANI among us today to help us understand this topic. The doctor will help us understand the process of growth and development in children and any necessary things we should consider in aiding that process. So, doctor, you have the stage.
Hello, good afternoon everyone. I am Dr. AVASH PANI. I am consultant pediatrician in Apollo Cradle, Kondapur. So today's topic we have selected as growth and development in infants basically. Telling every growth and development till almost 5 to 10 years of age will not be sufficient in one session. So I will restrict myself today to mostly 1 to 2 years maximum, where the maximum concerns are there and doubts are there. After that, usually not much of doubts are there after 2 years of age. Till 2, it is very critical. Every parent has a dream of seeing their children grow and develop to their maximum potential, and even more if possible. And most of the action happens in up to 1 to 2 years of age. That is the very beautiful time of the childhood where children are very innocent, and we can interact with them without any external world is not influenced them yet. So very innocent stage of the life. Okay, so first, what is growth and what is development? So growth is the physical increase in the like height, weight, age, head circumference, arm circumference, like that. So which can be measured by in some direct measurement like a weighing scale or a tape, like that. And development is the fine things which cannot be actually quantified. It's a qualitative thing which cannot be directly quantified. Gradual change in the function of the like development, ability of the hands to do certain work, which has no direct quantification, but we can see slowly that child is able to do things in better and better fashion. We'll come to that in detail later. So it is acquisition of new and new skills and doing those things in a better and better way. So that is the difference between growth and development. Now, in development, mainly there are milestones. So children are assessed on their milestones. So there are milestones are divided mainly into 4 categories. One is the gross motor, like standing, sitting, big whole body is involved in those gross motor things. Second is fine motor, where the fine movements of the hands, they are very required for eating, writing. Those things are seen in fine motor. Then third is language, where child is able to understand and interact with like other children and other people. Fourth one is social and adaptive milestones, where behavior and other things child learns how to deal with other people, how to interact with with his peer group, or how to behave with adults, like that. So these are the 4 main milestones where we uh, assess the child: gross motor, fine motor, language, and social. These are the 4 ones. So roughly we'll go quickly through we can't go in very detail because many things are there. No need to go into so much detail of all the milestones. But what is more important, like in 1 to 2 months in gross motor, child is moving all the limbs or not, we can see equally. So all 4 legs and 4 hands child is moving. So we can find to say to some extent that more grossly his limbs are working fine. If he is only preferring one side, only one half of body is moving, there it's a concern, and we should, or one limb is not moving much, it has to be investigated immediately. And by 3 to 4 months, child should have a neck holding. So when you are holding the child like this, in first 2 3 months we have to hold the neck also, support the neck along with the body. But afterwards we can hold like this, and the child is able to hold his head after 2 to 3 months of age. That is neck holding. And in the fine motor, he starts seeing his hands. That is normal in that age. He will just see what is trying to see. First thing that is nearest to his eyes are his hands. So hand regard it is called. These are very important. By 4th, 5th month, child is able to hold things in 2 hands and bring into midline, usually to his mouth, to put it in the mouth. So initially it will be holding things with 2 hands in fine motor. By 4 to 6 months, these things should happen, along with sitting with support. 4 to 6 months, child is sitting with support and holding things in 2 hands. And by 5th, after that, then next thing that is major milestone is rolling over in the gross motor. Child, if left on the floor, is rolling from tummy to back. That is very important. And then next is the sitting without support. By 6 to 8 months, child should be sitting without support and holding things in one hand. Maybe transferring from one hand, holding in one hand and then changing it from other hand, as opposed to holding it two hands initially and putting in mouth. So these are by 8 months, child should be sitting without support, and by 9 months, standing with support. So sitting with support, sitting without support by 8 months and standing with support by 9 months. So here one red flag we can remember, if child by 9 months is not sitting without support. So this one thing people can remember, that is the red flag we call it. So that has to be investigated. That means something may be wrong when child is not sitting still 9 months of age. So usually some people will ask you, other child is standing by 9 months, my child is not standing by 9 months. So that comparison need not be done. Every child has his own rate of achieving the milestones. But the key point are the red flags, where the first red flag will come when child is not keeping the neck by 6 months. 5 to 6 months are gone, but still child is not able to hold his head. That is one red flag. Second red flag is not sitting without support by 9 months of age. This people can remember. And then in the same, by 4 or 5 months, child should be also starting to creep on the floor. Rolling over is there, and child starts creeping. Creeping means tummy is still tummy is attached to the touching the floor, just not able to get up on all fours and crawling. So creeping comes first, like tummy is still touching the floor and he is moving around on the floor. That is creeping by 4 or 5 months. And after sitting like 6 months, he should be simultaneously crawling also, where the knees and elbows are only in contact with the ground and he is crawling all over the place. Some babies may not have all these things, so that is also okay. Some baby may not do creeping, directly they'll start crawling, and some baby means how do you say it? Sits for a very less period. Well, the gap between sitting and standing sometimes is very less. He sits and then immediately starts walking with support. So these are the variations depending on the age and the activeness of the baby. Sometimes very big babies take little more time to achieve all this because of the weight. Some baby may be born like suppose 4.5 kilos, suppose 4 kg plus. Those babies will take little more time for standing and all those things. That need not be. That's not a big worry. So creeping one thing, then sitting without support by 8 months. That is another thing. These are the important things. And then after 1 year, child should be able to stand without support, and that fine grasp comes. So this is called pincer grasp. He is able to hold things using the 3 or 4 fingers instead of holding whole like this. He is able to hold fine things with 3 fingers. Pincer grasp by 9 to 12 months, and by 15 months definitely child should be able to stand without support. So that is another red flag. Many children will be walking without support also by 15 months, but not standing without support by 15 months is another red flag. So we have to investigate in such situation. And in the fine motor, as I told, he is able to hold crayons and all. So then he can just take some crayon and start scribbling all over the. Sometimes he'll scribble all over the house also. So that time we can give some paper and crayons so that child is able to improve his grasp of the pincer grasp using his fingers. And by 18 months, child is able to run independently and making towers. So block games are there. So there will be small blocks. So child can pile one block above the other. So minimum 3 to 5 cubes he can pile by 18 months to make a tower of blocks. That is also important. So at 18 months, there is a red flag, not walking on its own. So by 15 months, child is not standing. By 18 months, child is not walking independently. These are the red flags. Needs investigation. Mainly, it can be from brain or maybe some localized limb or spine pathology. This has to be investigated. So red flags you can remember. I'll repeat the red flags at the end also. And by 2 years, you can see that child is able to walk up the stairs and use the crayons and draw circles and horizontal lines and vertical lines. By 3 years, child is able to ride a tricycle and makes a circle of maybe 8 to 10 blocks actually. Taller circle, he is able to balance those cubes, small cubes, up to 8 to 10 circles. And by 4 years, he is able to like hop and start hopping also on 1 feet. That much balance is there. He can start hopping on 1 feet and make a cross using the crayons. And by 5 years, he can start dressing and undressing also a little bit. Especially undressing, child can do first and copy the triangle. So triangle is little difficult, so it comes at 5 years, 4 to 5 years of age. Circle and cross are a bit easier for the child, so they are coming earlier. So uh, these are the things at the age which we described. These are mainly I have discussed till now gross and fine motor skills. Now coming to social and language milestones and social and adaptive milestones. So by 1 month, child is able to track the people, track other people who are keeping their face near to child is lying down. In 1 month, child is lying down. So people are seeing like this to child. So child is able to see and track the faces, sees the faces and tracks with eyes. His eyes are tracking whatever is moving in his environment. By 2 months completed age, there is a social smile that is very important, and also a red flag if not happening by 2 to 3 months. If somebody is really approaching the child and looking at the child and saying something, child should smile at least, not all the time, but definitely not zero. If child is not fixing, not tracking, not smiling by 2 months, that is a red flag again, has to be investigated. Maybe there's some vision issue or brain issue that has to be checked. By 2 to 3 months, in the same age, child should be recognizing mother. So when mother comes, child will start behaving he'll be more active. You can see that child can recognize mother, and the reaction to mother is different to the smell and presence of the mother. So and that time only child can make musical sounds like coo sounds and some blabbing, some typical cooing sound it is called. That sound a child can make by 3 months of age. Recognize mother, social smile, and cooing sounds. So these are at the 3 months of age. By 4 5 months, child is able to also laugh. The smiling comes at 2 to 3 months. Laughing sound might come at 3 to 5 months. And by 5 months, 6 months, he can see who is talking. If somebody is out of his vision, but some voice is coming, he'll start looking around. Where is the source? To locate the source of the sound by 5 months. By 6 to 7 months, child can talk in monosyllables like mama, papa. Single syllables he can repeat and recognize strangers. So he will, by 6 7 months, he will know his family members who are coming every day and seeing him, and strangers. So stranger anxiety comes by 7 months, which is absolutely normal. And at 7 months, there is a red flag if no vocalization, no cooing, and no babbling and monosyllables are not there by 7 months. Then that's a red flag again in the language milestone. By 9 months, there can be bisyllables like mama, baba, like that he can tell to father and mother, and even he can wave bye bye by 9 to 10 months of age. So typically, by 7 9 months, when the children are coming to, they are slowly recognizing the vaccination also. So I am seeing by 9 months they start crying when they are coming inside. Sometimes coming inside the pediatrician's room, they start crying and they are anticipating that something not so good is going to happen, especially vaccinations. By 12 months, child will start, if he is in the distance, if you call him, come, come, he will understand and he comes also. And he knows the meaning of no. So he is trying to do something mischievous and we say no, he is stopping momentarily. So he understands that he should not be doing it. Of course, they do it, that's a different issue. But he starts understanding the word no by 12 months of age. By 15 months, there will be neologism. That means children talk in their own language. It is nobody can understand, it has no meaning. But the jargon language is by 15 months of age. But by 18 months to 20 months, 1.5 years, child will have the 8 to 10 word speech with meaning. 8 to 10 words he will know, and one or two words he can use with meaning, like give water or I am hungry, something like that. So he knows 8 to 10 words by the 18 months to 20 months of age. By 2 years, he is like using a sentence, like 2 to 3 word sentence also child will be using. And by 3 years, he is knowing vocabulary is much advanced, and the group play is also there. And he is asking questions, some like what is this? So many questions start coming to their mind, and they can start asking questions also. So here one red flag is there by 3 years. If child is not able to speak properly in 4 5 worded sentences, and he is not able to play with his age group children, and the imaginative play is not there, like peekaboo kind of thing. So he is not able to play. So here, between 2 years to 3 years nowadays, autism is becoming. We'll not go to autism too much. Autism is becoming a more and more incidences there. So this is the correct time to pick up autism. Parents and the primary pediatricians can, if they look, may find the initial signs of autism by 2 years of age. 18 months to 2 years is the time when severe autism may be recognized, and therapies can be started also after 2 years. So if the child is not interacting with his peers by 3 years, staying in his own world, and not having eye contact, and not talking much, these are the red flags for autism, possible autism. So here he needs the child psychologist has to be involved, and we will have to evaluate for autism. And by 4 to 5 years, like child is doing everything, almost helping in household tasks also, go and get the water from cooler or something like that, and he asks various questions, like high level questions also he can ask. Why there is day and night, like that also people can ask by 5 years of age. So these are the 4 main milestones with red flags. And then coming to the growth, so average birth weight will be, minimum birth weight is 2.5 kg. So average birth weight will be around 3 kg. 3 kg is the average, like a middle level or 50th percentile of the birth weight at 3 kgs. So birth weight doubles by 5 to 6 months of age, and triples by 11 to 12 months of age. So if somebody is 3 kg, by 6 months he can be mostly 6 kg, and by 12 months he can be how much? 12 kg, 10 to 12 kg by 1 year of age. This is the average growth in the weight, and normal height at birth is around 50 centimeter. 45 is for preterms, and term baby usually 50 to 51 centimeter. And by 1 year we can expect 75 centimeter, 50% increase by 1 year of age. So 50 to 75 in 1 year of age. Like that, head circumference also we sometimes measure if we are in doubt. So by birth it will be 32 to 34 centimeters average, and by 1 year of age it can be around 45 centimeters. 34 to 45, 10 centimeter it increases in 1 year of age. Here a lot of doubt and lot of queries are coming from the parents regarding child is mostly child is too thin, child is not gaining weight, and child is not gaining weight as he was initially gaining. So child from birth to 1 year he has rapidly gained weight, from 3 kg has become 10 kg. After that 2 years, from 1 year to 2 years hardly gained 1 or 2 kg. So for that there is a concept of growth chart. So after taking readings from lakhs of children of normal age group, WHO has made a growth chart actually, and that various lines are there. In the three parameters we are checking: height, weight, and head circumference. Each parameter has 5 lines: 3rd percentile, 25 percentile, 50th percentile, 75 and 97 percentile. So 3 to 97 percentile is normal range. So in every 2 to 3 months, when you are visiting the pediatrician, you are measuring the height and weight, you make sure that it is charted on the growth chart also. So you can easily visualize that child is following the growth chart. Initially growth will be very rapid, but that rapid growth cannot continue. Every species has their limits of growth. So human growth can be charted on the WHO growth charts. So if you see the chart and follow it, you can understand that growth varies over age, and there are various, in some points there are growth spots, like initial first 6 months is a growth spot. At 2 years, after 1 to 2 not much of growth occurs. 2 to around 2 years small growth spot occurs, and again around 5 years. Then around puberty huge growth spot occurs. So I am seeing nowadays many parents are worried too much about child is not growing. So if the aid of if the help of the growth chart is maintained properly and checked I mean, I'm not saying to check every 1 month. That won't be necessary. Every 3 to 4 months is enough, so that we can understand the growth pattern of the child. So remember that doubles by 6 months and triples by 1 year. That is enough for basic understanding of the birth weight. So by 1 to 4 months, by 4 months, child is recognizing the familiar and unfamiliar. By 7 months, he is recognizing strangers and crying if stranger tries to like take the child. So stranger anxiety is there, and by 1 year, child might be knowing his own name also. If you call out in his name, he will respond specifically to his name. And same time, by 1 year, there will be trust versus mistrust. So known people, they will be trusting, sense of trust will be there. And if somebody else, like stranger, tries to pick up the child, most of the children will have a stranger anxiety, and they'll start crying if the stranger is near them or trying to take them in their arms. So what we can do for these children, knowing that the child is having this much growth, this much development in these ages. So we can provide them with play materials. Like initially 1 month to 4 months, we can have child is lying down, so there can be hanging toys and musical toys, balloons, rattles, etc., which they can hold and see, and the sound will come. So these are the hanging toys moving. They can track moving toys. They can see track with the eyes. First 4 months toys will be like that, and then 4 to 6 months soft toys you can give, like small toys which can be squeezed and can be put in mouth also. Putting in mouth is absolutely normal. Many parents are again saying the child is putting everything in mouth. That is how the child will explore the environment. That is how the child develops. Mental development also occurs. Do not try to stop this normal behavior of the child. To up to even up to 1.5 to 2 years, child might put things in mouth. Sometimes it becomes pathological, and that we have to deal. But initially, every child, that's a way of understanding the environment, putting things in mouth. And by 7 to 9 months, you can give squeeze toys which can make sounds. And then because at 9 months, child is sitting also, so then he can sit and play with the regular toys like blocks, cubes, plastic rings, and all these things to arrange things. And by after 1 year of age, cars and rides and all those musical toys, rocking horse, and various toys you can introduce by 1 year of age. So here one caution I would like to tell. This is very important. I am very much this message from my heart actually, that please do not use the walker. Nowadays, previously walker concept was not there. Only walker was the triangle. That's wooden walker where child, if he doesn't work, he'll fall down. That is okay. That has its own dangers, but that doesn't delay development. But this present walker, where it is a round shape with child sitting inside, and there's a big wheel base where child is just pushing with his legs and moving all over the house. That please do not keep it. If anybody is having it, please throw it away today. That should not be used. Two problems are there. One is the risk of injury. If child is moving and hits something, if it is not some variety of walkers, it will topple over and child. There will be head injury of the child. There can be nose or some other injury. That is one part, and second part is there is a delay in development also. Walking will be delayed if walker is used. Present modern walker is used because child is becoming a bit lazy by using the walker. He can move anywhere and he doesn't feel the need of walking. So please do not use the walker. And one more thing is that when child is more than 3-4 months of age, 4 to 5 months of age, many people are still keeping them on the bed with this thick mattress, where the child, once is pushing the mattress is going inside. Child is not feeling that force back on his body. So he is not understanding that once I push, my body will go up and I can look around, I can turn around, I can sit. So exclusively people are keeping on the bed with big mattress, the delay of development is possible. This milestone may get delayed. So this child, after 4-5 months minimum, you have to leave on the ground so that he can understand that if he pushes the ground, the body will respond and he'll get up. Even the muscles also develop a little bit. So you understand, no? Because if you leave on the bed, I have seen that slight delay will be there in the rolling over also, rolling over, sitting, everything. So these are the two things I would like to say. And play materials you can provide as age appropriate play materials. So growth chart I have already explained. So there is in the growth chart, the government also provides growth chart. So there it is very colorful. The middle is yellow, where it is just okay. Below yellow is the red, where it is underweight, and above green it is above the middle part it is green. Green is normal range. So from 3 to 97 percentile is normal. So it is slightly different from boys and girls. So we have to use the age and gender appropriate growth chart. It is available easily on the internet. WHO growth chart, if you type, you can easily get also. And then a little bit about the teeth. So teeth usually starts by 8 to 10 months of age. Lower central incisors, this lower middle teeth, they start coming out by 8 months. Some babies might get from before, and some babies might get delayed. So nothing to worry too much. It's very rare for any disease to cause the delay. Of course, it can cause. Very rare for diseases to delay the growth, and giving calcium and all, they really don't change the teeth eruption. Some people will give many type of medicines starting from allopathic to non-allopathic also. None of these medicines, calcium, vitamin D, unless they're really some really pathologically low, they won't affect the teeth eruption. So usually by 6 months, 6 to 8 months, the first teeth start appearing, and all the milk teeth fall off by 8 to 10 years of life, and the secondary teeth, the permanent teeth, they start at 5 to 6 years of age, and they continue to grow, and then some of the teeth they even grow at 18 years also. The wisdom teeth may appear by 18 years or later. So many parents are concerned with the teeth, rightly concerned of course, but we can still wait till 12 months to even more, for even if teeth has not appeared. Very rare cases. I have heard of one case where there were no teeth till 3 years. Child did not have teeth. Then teeth had to be implanted. Artificial teeth had to be put. So extremely rare case. Need not be worried about those. So that is little bit about teeth. And regarding vision, 1 month baby can fixate. Before 1 month he cannot. If you move something, he cannot track it. But 1 month of baby should be able to track any usually red color objects. We show red is the easiest to see. So red color objects baby will track like this by one month. And again baby can look and follow the mother's face by 1 month of age as the mother is talking to baby. And by 3 to 4 months, child can really reach out to the object accurately. He can judge the distance also. Suppose 1 month baby, if it is there, he might not be able to judge. His hands will all over the place it might go. But by 4 months, child is able to judge the distance and depth, and even reaching out and catching accurately with the hand. And by 1 year, like that slowly this will increase. And by 1 year, child can even follow rapidly moving objects. So that very fast tracking also can occur. So you can check the vision like this by tracking of objects. And hearing, very important. So first we are doing initially in the first we are doing by delivery also, just after delivery also. It can be done in first 1 to 2 months, the hearing screening test. What is hearing screening? It's a very simple electronic test where the basic function of ear is checked, if everything is just okay or not. So if the child is passing hearing screen, then he can be expected to have a normal hearing. So why it is important? If we detect an hearing loss early, then we can start see the root cause. If possible, we can treat it. Otherwise, from early onset only, we can start teaching the child sign language and take corrective measures. So what happens previously when the hearing screen was not there, not being used? After 2 years, 3 years, first we'll see that child is not talking. Then we'll investigate. Then we find that his hearing is there, not working properly. So he is not talking. Then valuable time is lost. Then training the child and his intelligence also seems to be little impaired. So hearing screen is very important after birth. And by 3 to 4 months, child can turn the house. There one more thing I'd like to say. So many people say we are doing like this and child is looking. That is not a sufficient test for hearing the 2 years separately testing. So if 1 year is working also, child will look like this. So that test doesn't. That is not sufficient. We have to go for the hearing screening test. That is the electronic test. please make a note of it. And by 3 to 4 months, child is actually tracking and locating the source of sound, and that is in the horizontal plane. But later on, child can even, once child is sitting, he can follow the sounds in all the three planes, up, down, and horizontal also. And by 10 months, child is able to locate the source of the sound accurately. So this was in brief about the growth and development of child, the normal growth and development with a brief mention of the red flags. And in the here most important is, I would say, hearing screen, because many people are not aware of it. Second is nowadays, because of even the corona and the social isolation that is happening nowadays, many children are having a delay in the speech. By 2 months, 2 years, they are also not able to speak properly. So by 2.5 years, definitely one evaluation should be done of the children who are not interacting properly, or language is not developing properly, and awareness of autism has to be increased so that they can be helped in time with therapies. And gross motor, of course, that is very easy to detect. Child is not, the red flags are coming. Child is not sitting by 8 months and not standing by 15 months, like that. If any red flag is there, obviously that is easy to detect. And then if any cause is found, okay, otherwise we can go for physiotherapy and other exercises to help the child to work properly. So today we conclude this session now. Thanks a lot for this patient hearing. Thank you. Any questions also, please ask.